Thank you for taking a couple minutes of your day to join us. My name is Hope Plack, and I'm here with Dr. Joseph Sievely at the Center for Natural Health Care in Red Wing, Minnesota. And today we're talking about Dr. Joe's Regenerative Knee Program. So to jump right in, Dr. Joe, can you tell us who is this knee program for?
Hope, this knee program is for anyone who's suffering from knee pain. The knee joint is a common site for arthritic change to the point where it can become bone on bone, and people lose their ability to do life without pain and discomfort. Just walking up steps or going for a walk becomes very difficult. Even moving in and out of your car can become painful and difficult. So the knee program is designed for anyone suffering from any type of knee complaint.
And Dr. Sievely, how many people are suffering with knee pain, are estimated at this point?
Well, right now we know that approximately 200,000 people are diagnosed every year with a new medial meniscus tear in their knee joint. 1 in 4 Americans suffer from some type of serious arthritic damage in their joints. 15 million Americans are suffering from some serious or severe form of arthritis in their joint. And again, the hip and the knee are very common weight-bearing joints that suffer the effect of arthritic change, as well as tears, as well as sprains, strains. All those things can affect the knee joint and a person's or an individual's ability to just move naturally, freely, without pain or discomfort.
And Dr. Joe, what is the common medical treatment for knee pain?
So most commonly, if a person goes to their medical doctor and they're suffering from knee pain, they'll evaluate them, and most commonly they'll give them a non-steroidal anti-inflammatory drug, which is designed to reduce swelling and inflammation. If the pain gets worse, then the next stage of treatment is injections, steroid injections into the knee. We know, though, that any type of treatment prolonged in that form can actually accelerate, Hope, the degenerative process in the knee joint, especially cortisone injections. So they're not a great long-lasting cure if there's an underlying cause for why the knee is hurting.
And what are some of the common side effects of these treatments? You mentioned with the injections.
So common side effects include, as I mentioned, degeneration of the cartilage through repeat injections. Also, bleeding and hemorrhaging in the stomach if a person's put on a non-steroidal anti-inflammatory that's strong, and it can erode the lining of the stomach. Typically, too, those non-steroidal anti-inflammatories are harsh on the kidney, on the liver, and on the stomach. So there's a whole variety of health complaints related to long-term use of any of those medications. And Hope, the thing is those treatments don't get to the root cause of why a person's suffering with their joint. So it's only a Band-Aid. It's not the way you correct the underlying cause.
And speaking of causes, what are some of the common causes of these knee complaints?
Old injuries, very common, where a person has sprained or strained their joint, never getting proper treatment. Muscular imbalances of the quadricep muscle and the lower extremity muscles pulling abnormally on the knee joint, inflaming the knee joint, making it difficult to walk. Another very common one, Hope, is people come into the office. One of the key things that we always look at in a knee condition is their feet. Many people have fallen arches, or one arch, the side where the knee pain is the most severe, that arch is totally collapsed, and they have no support coming from their foot into their knee. Then that causes that degenerative change and stress on that medial meniscus, and it becomes bone on bone.
Well, and so Dr. Joe, what does your regenerative knee program at the Center for Natural Health Care involve?
It involves a very thorough history and examination. It also involves an orthopedic and neurological examination of both the lumbar spine, hip joint, and knee joint, and the feet, because we understand it's a kinetic chain, and each of those joints, the ankle, the knee, and the hip, work together with proper firing of the lumbar spine nerves going into the leg. So all of those things have to be evaluated and properly assessed, and then treatment is rendered based on what we find.
Awesome. And then what is included in the treatment program?
So the treatment includes a whole variety of modalities. The first is we use what are called fast patches or whitey patches to reduce pain, swelling, and inflammation. And there's herbs in these patches that literally go transdermally through the skin into that damaged cartilage to begin supplying that cartilage with the nutrition that it needs to begin improving the quality of that cartilage's cellular health. We use a variety of nutrients to improve blood flow to the knee, as well as other nutrition specifically for joint repair and joint healing, and then other nutrients to help stabilize the tendons, the ligaments, the muscle function, reduce swelling and inflammation. So there's a variety of nutrients that we use, and the people can actually see the references on the website for those things. And then lastly, we do rehabilitative structural care, manipulation to the back, to the knee, to the hip, to the foot, orthotics, and then muscle balancing. We do acupuncture, we do pulsed electromagnetic field therapy, cold laser therapy. All these things are designed to regenerate torn meniscus, a arthritic joint, and rebalance the whole function of the knee.
Awesome. Well, Dr. Joe, thank you so much for sharing such valuable information with us today. We hope you found this information helpful. If you have additional questions, we would love to answer those for you. You can reach us by phone at 651-388-1211 or online at www.centerfornaturalhealthcareredwing.com. Again, thank you so much for joining us, and we hope you have a great day.